morning. 10 months into this pandemic, COVID-19 has infected more than 22 million people in the U.S., taking the lives of 373,000 people. The number of cases in many parts of the country are at an all-time high. In St. Louis County, we're averaging 530 new cases per day. While not at near record levels, the numbers remain way too high. We ask that you continue to hunker down and continue the responsible actions that have prevented this virus from having an even larger impact. St. Louis County residents continue to get sick and continue to die from the virus. We have lost 1,475 of our neighbors, friends, and family members to this pandemic. Vaccine distribution has given us all hope, but the rollout across the country has been slow. In St. Louis County, we received 975 doses last week in our first batch. On Friday, we began vaccinating our Department of Public Health employees. On that first day, we were able to vaccinate 180 of our clinical workers. We are pleased with the ability to get that many of our St. Louis County public health workers vaccinated in one day. In doing so, we are better positioned to issue the vaccine to others, including our clinic clients, as safely as possible. Those 180 public health workers represent about 65% of the 275 health department employees who are eligible based on the state's 1A tier of healthcare workers. This week, we will continue to offer vaccinations to healthcare department employees as we are scheduling the first of our non-DPH employees who qualify as healthcare workers in the Tier 1A as defined by the state. These are healthcare workers not affiliated with one of our hospital systems. We are scheduling 100 people each day, beginning today through Thursday. On Friday, we anticipate scheduling 320 individuals. In addition to nurses and doctors not connected to a healthcare provider, other examples of providers that would be eligible to sign up for the vaccine include school nurses, dentists, behavioral health and substance abuse providers, optometrists, and physical therapists. Any group of employees or an individual who is in that 1A healthcare category may contact our health department through email at dphcovidvaccine@stlouisco.com. That's dphcovidvaccine@stlouisco.com. The health department will respond with a link to an online form that you can fill out and request a reservation. We are not certain how soon we will get more vaccine, and we don't know exactly how many more doses we will receive. We ask for your patience. The entire process is dependent on the national supply chain, which is being handled here in Missouri by the state. I can tell you that our health department is ready to increase vaccination staffing as more doses become available. And as soon as we know more, we'll make sure that you do as well. Tomorrow I will be sworn in as county executive, along with 3 other council members, and an official ceremony marking the results of the November election. Like most every event that happened in 2020, the ceremony tomorrow will be virtual. But it also serves as a reminder of how we have adapted our lives to a new normal during an extraordinary time. Many people have indicated that they are happy to see 2020 in the rearview mirror. As challenging of a year as it was, we can always learn from the past, build on the successes that we've had, and push to improve. Our response to this pandemic will last well through 2021, and we will continue to follow science to make what are often difficult but necessary decisions to protect the health and safety of all. We saw last week what division can do in this country, and sadly the pandemic has become political and as a result showed a national response and created misinformation that jeopardized lives. We must work together if we want an efficient and successful vaccine rollout. We must work together if we want to eradicate this virus. Only 2% of Missourians have been vaccinated so far, about the same as our Illinois neighbors. We cannot even begin to discuss herd immunity until we get at least 70% of our population vaccinated. So clearly we have a long way to go. With the good news, we are on our way. Stay resolute, push back against misinformation. We know that masks save lives. We know that social distancing works, and we know that large gatherings are dangerous. We know the grade school lesson of washing our hands regularly and thoroughly is a lifelong lesson and an effective way to stop the spread of the virus. Please continue to follow the public health protocols, and until the vaccine is widely available, the risk is too high to let up on responsible actions. I'd be glad to take any questions.
Dr. Page, we have a few from Channel 4 regarding the vaccine. Why does the vaccine rollout appear to be so slow?
Channel 4 asks why the vaccine rollout appears to be slow. This is a new process, and we have a severely limited national supply based on production of something that's very new. Here in St. Louis County, we are setting up the infrastructure to get the vaccine in people's arms as fast as we receive that vaccine, and we'll be ready to do so.
What do you need from the state that you're not getting currently regarding the vaccine?
Well, we need the same thing here in St. Louis County that everyone in the country needs. We need more vaccine. And we're working with the state to make sure that we have a good plan to get the vaccine into people's arms as soon as we have it. We're working with our regional partners, other jurisdictions, to do the same. But we need more vaccine.
Kind of a follow to that. What could be done better? What needs to be improved as we roll out the vaccine to more people?
The question is, what can be done better? This is a new process, and anytime you have a new process, it's going to be difficult. But we have great communication with the health department in the state and our county department of public health, and we will continue that communication along with the regional health departments of other jurisdictions and other jurisdictions in the state to learn from their experience. What we need really is more vaccine. As fast as the vaccine can be produced in this country, we need that vaccine shipped to Missouri, and we need it shipped to St. Louis County so we can get it into the arms of St. Louis County residents. We will be ready to do that. We do need more vaccinating partners. St. Louis County will not have the ability of the infrastructure to vaccinate everyone. We will be working closely with other vaccinators in St. Louis County, coordinating with them, giving them direction, and helping to coordinate information and to help communicate among all St. Louis County residents where they can get a vaccine close to them.
Are you aware of any vaccines in the area that needed to be thrown out?
The question is, have any vaccines in the St. Louis region been thrown out? I haven't heard of anything like that.
Okay. What does the timeline look like to vaccinate all of the 1A in St. Louis County, and then what about 1B and when that may start?
So the question is about the timeline to vaccinate 1A and then when 1B might start. We currently don't know the timeline to vaccinate 1A because it is dependent on the number of vaccines we can get here in St. Louis County. And as soon as we have an estimate about the delivery of those vaccines, we will have an estimate about when we can vaccinate the thousands of St. Louis County residents that would qualify for a 1A vaccination. So we need more information about the arrival of those vaccines to estimate, and then when we are able to estimate that timeline, it will again be dependent on the continued supply of vaccine. 1B will start when the state gives us permission to move into 1B, and when we have an agreement that everyone who was 1A who wanted a vaccine had access to that. We will continue to communicate the value of the vaccine, the importance of the vaccine, and the safety of the vaccine as it has been established by our national testing. Many people here in St. Louis participated in those tests. We know this vaccine is safe and effective, and we hope everyone will get vaccinated as soon as it is available to them.
You may have answered this in your remarks, but this is from Channel 5 on vaccines. We've heard vaccine participation rates vary widely from one group to the next. Have you gotten any information about what percentage of county healthcare workers have accepted the vaccine when offered?
Well, we vaccinated on Friday everyone here in St. Louis County and our Department of Public Health, our healthcare workers who signed up for it. We vaccinated 60% of them, and we expect to get through the rest of them in the next couple of days. So at this point, we vaccinated everyone in St. Louis County who has been able to take the vaccine when we've had the vaccine to give it to them. We'll have more data on the percentage of people in St. Louis County, the percentage of public health workers who've accepted the vaccine moving forward. It's hard to give that number of people who have accepted it when we haven't yet had enough vaccine to give it to everyone who falls into that category.
This is a related question from the Post-Dispatch. Has the county encountered resistance to taking the vaccine from qualifying medical workers, and what should people who are hesitant to take the vaccine know?
Well, there is still some anxiety about a new vaccine. We're working through our healthcare partners to help people understand that. But as far as the percentage of uptake of the vaccine in our health systems, I would have to refer you to those health systems to give that number, because we are currently still vaccinating 1A healthcare workers. It would really not be prudent or understandable to give a number as to who has accepted it and who has declined. Not until everyone, and not until we had enough vaccine to vaccinate everyone in that category.
What type of outreach is being done to reach those who might be resistant or unfamiliar with the vaccine?
Yeah, part of what the Department of Public Health is doing, the medical community, the pandemic task force, a lot of our institutions and community partners who are all communicating with our with St. Louis County residents on the safety of the vaccine, the importance of the vaccine, and why individuals in St. Louis County should become vaccinated, not just to protect themselves, but also to protect their loved ones, their friends, and their neighbors, and any patrons at their place of employment. We will continue that communication effort and that education through the St. Louis County Department of Public Health. We put a lot of resources into that. We will continue to put a lot of resources into that, and that communication is going to be amplified and accelerated.
That's all I got.
Okay, thank you.